I have that, but I have not been taking it.
Okay. And then the Plaquenil?
Is that the blood thinner? No.
No, it's the hydroxychloroquine.
I have been taking that.
And then the other one is the oxycodone, the narcotic pain medication.
No.
Yes.
But
I think I sent you that gabapentin because you didn't want to use that oxycodone.
that's correct. I am taking the blood thinner, the needle, every day.
Oh, yes. Yes. That is still, yeah. After surgery, we really give that.
And Enoxaparin,
So do
whatever
you
it
want
is.
me, yeah, so, okay. Since you're not really in pain, do you want me to take out this narcotic on your list, the oxycodone?
Sure, absolutely.
Yes, okay. Will do. Okay. And then I know that Dr. Morris has spoke to you on the phone yesterday,
Yes,
and then she discussed the pathology.
a little bit.
Yes, and then the need for chemotherapy.
Yes.
Okay, so I need to ask you, where do you want that done? Locally? I know you are in Lodi or here at Stanford, so we can arrange for the referral.
Yes,
It's your Stockton guy, right?
it is in Lodi. Yes.
I thought he was in Stockton.
It's Stockton in Lodi.
Okay. Do you have you chosen a doctor yet so we can send the referral?
Yes, I have.
Okay, may I get the name, please?
Yes, I believe it's Medi. One moment. Yes. Oncologist.
Sure.
The oncologist is Dr. Medi, Medhi. I have his number.
Okay.
Do you need
Yes,
it?
please.
209-466-2626. And I do have a second number. I'm not sure what this one is. 209-366-2616.
Okay. Did they have a fax number there?
I do not see a fax, but I can get that to you.
Okay. Oh, it's okay. What do you know? The first name. This is Dr. Medi is the last name, correct?
Yes.
What is the first name?
I'm not sure if I have that right here.
Okay, we can just try to figure it out. But he is in Lodi.
Yes, yeah, they have offices in Lodi and Stockton. Yes. He's part of a.
And Stockton. Oh, okay. So I will step out and see if Dr. Morris is ready to come in. And then I will give this information to our nurse so she can start sending in the referral.
Okay, thank you. Well,
Okay,
don't I
I'll
want
be
to
back.
talk to don't I want to talk to Stanford oncologist?
Why?
Because Mike wants me to get there.
No, that's Dr. Morris you're going to ask.
Yes. Okay. Also, we would like to see your belly. Okay, be prepared to show us your belly later on when she comes.
Okay.
Okay. Thank you. Excuse me.
Okay. Do you want to put Mike on the phone?
I can't. How are you going to put him on Zoom?
With your phone.
I can't.
You and him Zoom.
No, he doesn't, but he doesn't need to see. Were you able to hear okay, Mike?
It's a little metallic, so some of it, I think I'm getting the gist of it, but it's not completely clear.
Yeah, he's a little metallic to us too, but.
Okay. It might be that particular microphone that they're using.
Yeah. I think she's has a little more gentle of a voice, so it might come across a little better with her.
Okay.
So that's the nurse practitioner.
Yeah. One of the questions for you guys is, would there be a benefit if Auntie you get seen by an oncologist at Stanford to make sure that the therapeutic plan is really optimized for you, and then actually getting the medicine can be done locally in Lodi?
Yes.
Okay.
You're a little bit more complicated because of your autoimmune disease and some other things, and We just want to make sure that you get the best regimen, most up-to-date regimen possible.
Thank you. She knows you're going to be on. Mike, good morning.
Good morning.
Good morning.
Hi, I'm Arden Morris. I know I'm talking to somebody I haven't met yet.
Oh, Dr. Mike, you mean on the phone?
You can leave them.
I think so.
Yes.
Okay, and is your son there as well?
My
Yep,
son,
I am.
yeah.
All right, great. Well, nice to be talking with all of you. First of all, Ellen told me that you're generally feeling pretty well. You know, we spoke last night, but I just want to double check. Are you still having some bloating this morning?
A little bit, not much, but a little bit, yes.
Okay, I suspect that will keep passing. And are your guts basically working okay? Able to eat what you're hungry for and able to pass it through?
Yes.
Okay, seeing any blood?
No.
Okay, all of that is really good. We do want to take a look at your wound, but whatever you're comfortable with in terms of your son and your
That's all right. I'll just walk over here and show you for sure. You want to look at it now?
That would be great. And
Okay.
then let's talk. Yeah. Yeah, that does look good. Actually, it looks really good. So that little skin fold, could you kind of pull upward on that? That's it. Okay, beautiful. It is fine to peel that tape if it bothers you.
Okay,
That looks good.
okay, I've been waiting for it to fall off.
Okay, yes, and that's fine too. Either way is really okay. The other thing I want to say is that if you feel that, it's going to feel pretty firm, and you are going to feel a knot of suture under your skin. You'll feel it. It's a hard knot, like a small hard pea. That is suture that your body will absorb over time. We want it to last about 6 months while your tissue underneath your skin heals.
Okay.
And so that's intentional, but ultimately that will go away, and also your scar will soften up.
Okay.
So we have your pathology. You and I talked a little bit last night. Oh, that's okay. I remember it. So yeah, we talked last night about your path, and there are some features that are more concerning and other features that are more encouraging. So we know that you have a number of positive lymph nodes. 6 positive lymph nodes out of, was it 15? 6 out of 15 that I took out. So that's concerning, and to our minds, that automatically means chemotherapy, especially for somebody who's so, kind of active and with it like you, because we want to optimize your quality and quantity of life.
Thank you.
In the pathology, you had something called that we look at that's called, I don't want to get too technical here unless you want me to, but it's called mismatch repair proteins. You had some, this is the encouraging news, that you had 2 mismatch repair proteins that were abnormal, and that means that there are more options for therapy, including something called immunotherapy that is a little bit more effective. What I'd like for you to do is to discuss this with the medical oncologist, because they will have all of the latest numbers if you want them. And I don't have all of those latest numbers about the relative effects of chemotherapy versus immunotherapy for this. But it is good to have options, especially effective options.
Okay. I know Mike's on the phone here, and it's hard for him to hear because we're doing, speakerphone, but that's his specialty is immunotherapy, but he does it with kids. He was a pediatric oncologist, and his immunotherapies is his wheelhouse, so.
Great. And you will be able to access your pathology result in My Health. I wanted to discuss it with you before releasing it, but I'm going to go ahead and release it right now. So that you can see it, and that way you can share it with anybody you want to. Now let's see. Actually, I think I have to.
You have to be on your own.
I have to be on my. Okay. How do I get back to right here?
No camera. Yeah.
Right. The camera icon is a square within a square. Who would have thought? computer and release that so that you can share it with Mike if you'd like to, or with
Yeah.
anybody.
Okay, thank you.
Yeah. So what questions do you all have?
Can you relate to our surgeon that because of Auntie Judy's history of autoimmune disease, that we're hoping that she can get a consultation with the Stanford oncology team to really understand the ups rather than
Sure.
just Lodi practice.
I heard that well, and I would say that we do this all the time. And our oncologists will do that sort of one-time consultation and think about what is the best recipe for individuals, and then communicate that with local medical oncologists. It seems to work very well. So we're happy to do it. And I'd be very happy to set that up. I can think of at least 3 people that I think would be great for you to see. So whoever's open first, potentially.
Thank you. So you set that up?
Yes. Yeah, we'll make that referral. And let's start with George Fisher and then Tyler Johnson after that. And then if neither of those is available very soon, which they both tend to be.
They tend to be available.
Then I would go with Greg. He's okay. All right. Other questions?
I know Mike also asked about on the tumor itself about further testing for just reaction because of my mom's autoimmune issues. So just if the tumor would be further tested just for reaction to, the medication.
Med-Onc normally does that.
Yeah, with oncology.
Yeah. Normally they will see to it, like if it's done, then they will request for that if needed.
Yeah. The medical oncologist here will probably send they'll probably send an oncogene panel, although that has gone in and out of favor for colorectal. I bet Mike knows more about that than I do. But it would be better if we leave it to them because that'll be their area of expertise more than mine.
Okay.
Yeah.
Okay.
Okay. Anything else?
I don't think so.
I don't think so either. So, I guess the next step is to certainly talk to the oncologist up there. Would I be able to have a virtual, or do you think that has to be a physical appointment?
It depends on them. Yeah.
It's up to them, but they do a lot of virtual visits.
Okay.
The fact that, and I think, they can easily review your chart. We've got all your information here. So they can and will do that in advance. I'm betting that you can just do a video visit, especially now. I mean, there is an appropriately mounting paranoia about patients and caregivers and everybody getting sick. So my guess is that they'll be very open to a video visit, and I think that would be the best. And what else did I want to tell you? And I want to see you back in 6 months.
Okay.
I want to see you back in 6 months just to make sure everything is going the way that we want it to.
Okay.
So that would be a follow-up visit.
Yes.
Who knows? Who knows if we can do things in person in 6 months or not?
Right.
I think we should schedule it as
in person.
we should schedule it as in person, and then we'll just revert to video visit if that's the best thing for you.
Okay. All right. Very well.
Yeah. Okay. Good to see you. I'm glad
Good to
you're
see
doing well
you.
in general. Keep in mind that even for people who are 30 years old, it takes them months to feel like they've got their energy level back and that they're feeling the way that they need to
Okay.
get through the day.
Yeah, a lesson in patience for sure.
Yeah.
Yeah.
Yeah, it certainly is. All
Thank you. Thank you for the excellent work.
Well, you're quite
Nice to
welcome.
see you.
Nice to see you. Okay.
Thank you. Thank you so much.
Yeah.